Are South Africans heavy drinkers? According to the World Health Organization, the average South African consumes almost twice as much alcohol as the global average. South Africa also has the continent's highest proportion of people living with diabetes. So what are the risks of drinking if you have diabetes? To tell us, we're joined by Dietitian Omy Naidoo. A very good morning to you. How bad is it, the combination between diabetes and alcohol?
Good morning, Jane, to you and your viewers, and thanks for having me on. I think the combination is literally deadly, and that's the fact of the matter. With alcohol, you have a higher risk for low blood sugar levels, hypoglycemia. So often you have diabetics who consume a fair amount of alcohol, and the end result is that maybe 4 to 6 hours later, they dip into what's called a hypoglycemic coma. The problem, Jane, is that a lot of the time the symptoms mimic that of being intoxicated. They may have slurred speech, they might wobble around or feel dizzy, and to their peers they may actually feel that these people are just intoxicated. But the fact of the matter is that they're having a medical emergency.
And if that medical emergency isn't dealt with immediately, what might happen?
So there's three things, there's 3 stages. You firstly get a loss of consciousness or a seizure, and then eventually after hours you can have death. The problem is, I always tell my patients, the effects of high blood sugar levels damage the body and cause them to have issues over a long period of time, whereas with low blood sugar levels, within a few hours you can die.
All right, so how many drinks can somebody with diabetes have?
Jane, I think that's a good question, but just to take a step back in that the statistics are showing us that us as South Africans, besides drinking a large amount of alcohol, we are what's called binge drinkers. And that's where we basically have a few days in the week where we don't drink alcohol, and then suddenly come the weekend, we traumatize the system with copious amounts of alcohol. So if you're looking at the standards, we're saying 1 unit for women per day and 2 units for men per day. If you're looking at it, what is a unit? It's 1 tot of a spirit, so that's a single, about a 330 ml beer, or a medium glass of wine, which is approximately 200 mils.
Wow, I mean, that really is restraint, isn't it? And I should imagine it must be pretty hard to get people to stick to those limits.
Yeah, you know, Jane, the other thing is, aside from the low blood sugar level, which is very, very dangerous to the patient, on the other end of it, a gram of alcohol has similar calories to a gram of fat, meaning that if I'm sitting with an overweight diabetic trying to help them control or restrict their calories, that 1 or 2 glasses of wine in the evening is going to throw our calorie counter all off.
And I should imagine cholesterol will become an issue then as well. So health benefits, is there any at all? I mean, often we've heard that red wine can be good for the heart. Is that true?
I think, you know, that is true. Red wine is good for the heart. It's high in antioxidants. But I would never tell a diabetic who does not drink alcohol to start consuming it. And also with alcohol and diabetes, it causes an unpredictability in the blood glucose profile. So what happens is, often imagine at 4 o'clock in the morning, waking up in a sweat, but having a high or low blood sugar level event. So with that, I would say avoid thinking of alcohol as having a health benefit. There's various other things that you could do for health benefits.
All right. If somebody feels that they've got a problem, whether they're diabetic or not, what should they do?
I think the International Diabetes Federation has a slogan each year, get to know your numbers. So the first step is to get to your doctor, get to your clinic and get tested. You know, look at your blood sugar levels, look at your blood pressure, and look at your cholesterol levels. And then also, if you are feeling that you are at risk, maybe start practicing moderation and try and find techniques to sort of limit your consumption.
All right. I mean, Naidoo, good to talk to you. Thank you.